Dr. Meenal Dhabalia. I'm an obstetrician, gynecologist, and infertility consultant with a special interest in endoscopy. Today, I have come up with a very interesting and special topic. Are you interested in adding a bundle of joy to your life? Or are you planning for pregnancy? If yes, then this video is for you. In this video, I'm going to talk about the blood test and the things which you should know before you actually plan your pregnancy. So whenever patient comes to me for counseling before they plan for the pregnancy, I generally discuss this under two headings. Number one is emotional preparation and the other is physical preparation. For me, emotional preparation is equally important as physical preparation. For emotional preparation, number one is even if the female is going to bear the pregnancy and female is going to take the pregnancy ahead, it is the mental preparation of both the partner which sails them happily through this journey. So both the partners should be mentally ready to take this journey together. Secondly, since now everyone has a nuclear family, it's always better to have your family in the loop, so that even if they require a bed rest or there is some emergency, your family member is always able to help you or reach to you. Third is financial aspect has to be discussed, because suppose by any chance female need to require the bed rest and she is not working, then you should have financial security to take this pregnancy ahead, and you should not be bothered about the financial aspect in the pregnancy. And fourth and very important point for me is, since the female has to increase weight by 10, generally they increase weight by 10 to 12 kgs or sometimes even more, and there is a change in the body shape and the size and there is a swelling, so sometimes they are very bothered whether they'll be able to go back to their pre-pregnancy weight. So it is very important to give them the assurance that definitely post delivery they will be able to shed this weight by healthy exercise and doing a perfect and keeping a perfect diet and healthy lifestyle. So giving a emotional security, emotional support in all this matter is very important for the couple who are trying for the pregnancy. Now coming to the physical preparation, history taking is very important. You have to ask them the history of their menstrual cycle, or female, whether female has a regular menstrual cycle, or there is a abnormal or delayed menses or scanty menses is very important. Then asking about their dietary habit, well, how is their diet, are they working, or how is their sleep pattern, and then the internal checkup or per-vaginal examination of the female, and in the last the pelvic sonography of the female to know these type of whether the uterus is normal, how much is the endometrial lining, and how is the ovary, whether ovaries are normal or it's a polycystic ovary, so that before starting a pregnancy, before they even plan the pregnancy, they know the status of their body, and if any more tests are required, we can do all this test. Coming to the blood examination, there are so many tests, but few important tests which I am going to discuss is, number one is hemoglobin level. See, anemia is very rampant in India, so it is very important to do your hemoglobin level. If hemoglobin is less than 12 or between 10 to 12, then it's a good idea to take a iron supplement for 1 or 2 months and take a diet rich in iron and build up your hemoglobin level to 12, and then you plan a pregnancy. If your hemoglobin level is less than 10, then few additional tests has to be done, because then you have to investigate which type of anemia it is, because always it may not be iron deficiency anemia, it may be thalassemia or sickle cell anemia, which again is very common in Indian population, and which has a different treatment and it has different impact on the pregnancy, and so few specialized tests has to be done if your hemoglobin is less than 10. Second important blood test in pregnancy is thyroid test. Hypothyroid or hyperthyroid both has its own effect on the pregnancy, so before that you should know whether your thyroid level is normal or not. Third important test is blood sugar level. Since now more and more of females are going for pregnancy in their late 30s or in their 30s, when they're already has a slight hormonal imbalances, their obesity is on the rise. So all this with their sedentary lifestyle can give rise to the sugar derangement or sugar abnormal sugar levels in their body. So it's always better to know that, because abnormal sugar level can lead to the gestational diabetes in the female, which has its effect not only on the female but also on the baby too. So it's important to know your blood sugar level. If it is not normal, then take this opportunity to start exercising, taking a healthy diet, and normalizing your sugar level. Again, one very important thing is your dietary habits. What are your dietary habits? Are you taking a regular diet? Since you have a sedentary lifestyle, most of the time their breakfast, lunch, and dinner is hashes. They are not able to take sufficient nutrition. So see to it in this time that you take adequate protein, sufficient complex carbohydrate, vitamins, minerals, and food rich in healthy fats. So if you'll take a healthy and if you start taking healthy and nutritious diet from this time, then this goes in a long way in having a normal and healthy pregnancy and healthy and normal baby. One of the very important point which always I want to discuss with my patient are their smoking habits. If female is smoker, then the chances of intrauterine growth retardation, this means growth of the baby is affected in pregnancy, is quite common in smokers. Secondly, smoking can also stimulate few anomalies in the baby, so it's absolutely no in pregnancy. So before you plan your pregnancy, you have to quit smoking, which is very important, and it is must for the female. For male, if male is a smoker, then it affect their sperm semen parameters. Sperm counts are less, and sperm motility will be affected, and it can lead to infertility, and it can delay their conception. So smoking in both the partner, male and female, has to be stopped altogether, and at least they should try it from the 3 months before they try for pregnancy. Now, there is a role of prenatal. What is the role of prenatal vitamins? So much is said about the prenatal vitamins. See, most important vitamin in this is folic acid and methylcobalamin. The role of folic acid is that it enhances the growth of the baby, number one, and number two, it prevents so many anomalies like spina bifida and few neural abnormalities, and it helps in the growth of the neuron system of the baby and spinal cord. So it's a very good idea. In fact, it's must that you start on the prenatal vitamins, especially folic acid and methylcobalamin, at least 3 months before you try for the pregnancy. Now, one important question: does all this testing is required by only female partner? No. Male has to do all the tests. Male also has to do few testing like blood group. Now, if their blood group is positive and female is also positive, there is no problem. But suppose female is negative and male is positive, blood group is positive, then few additional tests is to be done for RH incompatibility in pregnancy. So it's a good idea to know beforehand what is your blood group. Number two is sugar level in the males, because the obesity is on the rise. Sugar level and their sedentary lifestyle may because of that they may become diabetic, or their sugar level is slightly on the higher side. But this high sugar level may affect this sperm motility and this sperm count. So it's a very good idea to regularize your blood sugar by taking a healthy diet. Then again, doing a semen analysis is important, because you should know how much is your sperm count and is the motility. Because if it is abnormal, then timely you can take a supplements, or take a help of the professional to normalize, so that there is no problem in conception. So my take home message to the couples are: if you're planning for the pregnancy, take all, as I explained you before, do the blood test, start taking prenatal vitamin, keep a healthy and nutritious diet, do the exercises, avoid sedentary lifestyle, and give your body at least 4 to 5 months of time. Even if both the partners are young and their reports are normal, it sometimes take 4 to 5 months to conceive. So don't panic. But if they are more than 30 years and if they have any problem like there's a PCOS in the female or the male partner has slightly abnormal sperm parameters, like their motility is on the lesser side or count is slightly less, then it's advisable to take a consultation with the infertility consultant after 3 to 4 months of trying. So I hope you like this video, and if you have any question, please feel free to ask me in the comment section. Do like, subscribe and share. Thank you.